All right. All right. Good morning, everybody. Thanks for joining us. My name is Jenny Jasinski. I'm the program manager here at Pink Lemonade Project.
And I'm Susan Stearns and run the organization.
All right.
All right, I'll jump in.
Sure.
So thanks for being here today. We want to do an overview of our programs. There are always a few new things or a few updates that we try to share with all of our providers because you're truly critical and essential in our helping as many breast cancer patients as we are currently serving. So just a little bit of background and some touch points on current data and trends with breast cancer. And then really Jenny's going to hop into the nuts and bolts of our programs. But just for anyone who might be new, our mission is to educate, empower, and support all communities affected by breast cancer. Our board has worked hard to define values, which you can see in front of you. And when we talk about today's approach, it really is sort of a philosophy of how our organization operates and how we address how we are approaching the work and the needs both on the education and awareness side before a diagnosis and how we're committed to helping patients after a diagnosis. So today's organization is doing a lot more to really evolve some of our original programs to meet more need and to fill more gaps and or address some of the health disparities that are playing out in breast cancer. We are emphasizing building more partnerships and working across all the communities that we serve. We're using data to really drive our decision making and our priorities. We're very aware that it's important to create awareness and promote education around breast cancer as it's a screenable cancer, and it's also a leading cause of death and illness to women. And then organizationally, we're really trying to play a greater role of convening and being problem solvers and not just responding to patient needs after a diagnosis. Our early history, next slide, Jenny. We were founded by Doctors Alan and Cassie Gabriel, who are two Vancouver, Washington-based physicians. He's a plastic surgeon, she's an anesthesiologist, and together they saw the emotional and psychological challenges of their breast cancer patients following all their medical treatment. So our early programs were retreats, peer mentorship, and education sessions with our local provider experts. The other significant milestone was in March of 2021 when the Komen, Oregon, Southwest Washington affiliate closed as part of a national restructuring of the Komen organization. And they approached Pink Lemonade Project to take over two of their local programs that otherwise would have been sunsetted. So we added at that time the metastatic breast cancer dinner series, and then a much larger program called Treatment Access Program, which was a Komen financial assistance program that served all of Oregon and Southwest Washington. And when our board accepted both of those programs, they also agreed to continue the Komen boundaries. And so we added our work, and over the last few years have been integrating all of our programs and efforts to serve all of Oregon and Southwest Washington, which is a total of 42 counties back from the early days when we were either Clark County only or really serving the Portland, Vancouver metro area. So we have grown significantly. Just some touch points on breast cancer facts.
There we go.
Thanks, Jenny. 1 in 8 women on average will develop breast cancer in their lifetime. And those are national numbers. And we know that the Pacific Northwest rates are higher than that. We know that 1% of men will get breast cancer. So when I do a community education event, I talk about how really we're all human and we have breast tissue, so we're at risk of breast cancer. 20 to 30% diagnosed early will likely experience a recurrence, and only 15% of cases are due to family history. So it's actually a smaller number than some might assume. If people have the BRCA mutation, that puts you at high risk, but overall for the general population, family history is a low percentage. So there are a lot of things we don't know about why there's so much breast cancer. We really are being more inclusive and making sure that we incorporate the MBC or metastatic breast cancer community in all of our work and programs. We know that about a third of women diagnosed with stage 4 metastatic breast cancer are living at least 5 years. Some may live 10 years or longer. We've got some of those women involved in our work. There are 168,000 approximately people across the US living with MBC today. And we know that there's a significant disparity in where research dollars are spent, and a very small percentage are for new treatments for those with stage 4. It's a community of patients or women who feel more alone and more left out by the available support services for breast cancer patients, or for those diagnosed with an earlier stage. But also just these are women who literally are banking on new research and new treatments to extend their lives. And so there's a strong advocacy arm for the MBC community to get more research dollars directed towards stage 4 breast cancers. And then this is a slide that's actually pulling from more current data from both the Oregon and the Washington state cancer control plans. The cancer control plans are like statewide strategic plans to address cancer. There's been a big delay in gathering current or sort of current data since the pandemic, or the outset of the pandemic, where we know that there was a up to 80 or 90% drop in screenings during that 2020 spring and summer. So we know there's sort of a bubble of more later stage diagnoses, more breast cancer related deaths. And the question really has been, what's the most current data to kind of show the impact of COVID on a screenable cancer? So from the cancer control plans, we know that there are more women under age 40 getting breast cancer. So the current screening guidelines are that screening starts at age 40. So these are diagnoses that are coming in before that recommended screening start time. We know in rural areas that more people are getting later stage diagnoses. We know that more younger women, and especially African-American women, get triple negative breast cancer, which just can be trickier to treat. And we know that more younger people are ultimately getting diagnosed with metastatic breast cancer. And our rural counties absolutely have the highest mortality rates. It's true in both states. It's related to all the access and barrier issues. But we're concerned about really these newer trends, which we see as really a setback to progress that we've made with this disease over the last many decades. The other thing just to point out is that screening rates have dropped fairly significantly. So we have not yet returned to pre-pandemic level screening rates. So Oregon's doing a bit better than Washington, but both states have work to do to recover and get our screening rates back up. So Pink Lemonade Project's trying to look at how we can be more helpful on the front end of the education and awareness to try to impact and get these numbers up. And then just this I added in, but we absolutely know that if people are insured, they're more likely to actually keep up with their regular mammograms. And so just with the trends in the healthcare system right now, we are concerned about people losing coverage, Medicaid and others, quite honestly. And so, I mean, you're living it. And also, we're just trying to see how we can fill gaps and get information out for those who are and underinsured, because that's going to be a greater percentage of people moving forward. Just to say, I mentioned it in our approach when I was talking about our approach, but really we are more than just our programs today, and we're really building a much broader and extensive network of partnerships and relationships to help us fulfill our mission. And so that's everything from trying to visit and spend more time at the cancer centers and the radiology groups to get to know the staff so they're aware of all of the programs that are available, and this training is a part of that. But also on the community side, We're doing everything from more faith-based events. We're trying to show up and table at more health outreach events and just make sure that people know about screening guidelines and breast health change information. So again, we're trying to help more people ahead of a diagnosis. And then I'll talk about it later, but we're working to train community health workers. So slightly different graphic if some of you have presented or done this presentation before, but we really talked about how our programs span the cancer continuum, but now we're really talking about how we're moving upstream. So this is sort of a public health model, but our early programs were along the bottom edge. So you see our retreats or our mentor programs or the support groups. On the lower right, on the lower left, we've done patient and provider resource guides. And then over the last couple of years, we're moving midstream and upstream and trying to get ahead of the diagnosis. And then I mentioned our faith-based awareness events in the fall, but also our community health worker project, where in both Oregon and Washington, there are literally thousands of CHWs now, both in community settings as well as in clinical settings. And that in Oregon, for example, the certification process includes no information on cancer whatsoever. And so we've been working with the Knight Cancer Institute and training CHWs on really general cancer trends. And then we've got Pink Lemonade Project offers a specific breast cancer overview training, and then explains more about screening guidelines, and then breast cancer supports after a diagnosis. So really a very small yet mighty scope of work, and we're trying to do more systems change work to address some of the inequities we are seeing in diagnoses and mortality rates right now. Any questions on that? I always talk fast, but want to pause for a moment.
No.
All right. Take it away, Jenny.
All right, so jumping in with our program events, formerly known to many of you as Pink Link, if you've referred any of your patients to us before for these. These are community building events that we offer, both virtual and in person, and they include everything from social, wellness, learning, fitness events. We have some interesting events coming up in the near future. We've got some sort of breast cancer rehabilitation where we're working with folks to help them open muscles, open the airways, help them just sort of get some of that movement back. We are doing monthly walks led by one of our volunteers, and she's someone who's living with NBC right now, and she's doing walks all over the Portland, Vancouver metro area. So that's really great. We're doing educational events as well with the Lobular Cancer Alliance. They're going to be doing an event for us in September, just talking about lobular cancer with Dr. Sasha Stanton. So lots of different topics that we're covering, and we'd love to get your referral on those for your patients. As I mentioned, medical experts in various topics. And then we do record the presentations if they're virtual, and they live in our YouTube library for anyone to view in the future if they missed or to revisit. And then our financial assistance program. So here we've had quite a few changes. Some of you may remember that we had our Pink Practicalities program, our TAP program, Treatment Access Program, and then Holiday Glow. And we've combined two of the programs, Pink Practicalities and TAP, into one program, which we're now calling a Financial Assistance Program, just to simplify things. And so what this allows us to do is remove the mileage requirement for those living in rural counties who were hoping to get help with travel assistance in terms of gas and any kind of travel expenses that they may have in order to get themselves to treatment. And so just really simplifying this down so that there's less barriers for individuals to get help. And so this program is going to run January through November. As I mentioned, it does not have a mileage requirement. One of the changes that we are implementing is that each patient can only be funded once annually by this program. And then this program will serve all of Oregon and then our 6 counties in Southwest Washington that we're covering. And we'll go into a little more detail in a minute. And then just briefly, we also are still offering the Holiday Glow program, which so then the financial assistance program will shut down in December temporarily. It will open up the Holiday Glow program. And this program is kind of designed to help families just get through that holiday time with whatever costs that they may have associated with that. And this program is sort of more concentrated in the Portland, Vancouver metro area versus all the other rural areas. And so I'm going to stop sharing this screen for a moment.
And Jenny, if I can just
Yes.
say, especially since Michelle's on the call. So Michelle, in the past, the treatment access program really was limited to transportation support,
Right.
food and lodging for rural patients who were traveling distances to get to their treatment. And the Portland, Vancouver metro area had financial aid that was actually a lot more, it could be used for anything. And we didn't ask a lot of questions. So we just really did a smash up of these two programs. So the financial aid dollars that are available to rural patients can be used for anything that they need. So food, lymphedema sleep, supplements, gas if they need it, lodging if they need it. We're not asking questions, but it's just maximum flexibility to help them with any of their financial needs. And we're just trying to make it simpler for the but also give more flexibility to the patients of how they, how these dollars can be used to support them.
Okay. One question I did have was, it's an annual distribution. So does that go if I have a patient that was funded something in November, does January count as a new year, or does it go from November to November for that person?
No, November to November.
Okay, thank you.
Yeah. So if every time we get a new application and we just check the date of when, if and when they were last funded, and it's based off of that month. So
Okay, thank
yeah.
you.
Can you see the financial assistance website page?
Yes.
Yep.
Great. Okay. So this is not the homepage of the website, but from the homepage, just in case you haven't used this before, you go up here to the Get Support, drop down to the financial assistance, and when you click that, it'll bring you here. And just to go over some of those brief things, someone on the person's oncology team, you all, not the patient, do apply for this on this program. Sorry, lost my words there. However, the patient must complete the ROI, the release of information, and I'll show you that in just a second. We also ask the patient to fill out a short survey after they receive an award, and there's roughly a 6 to 8 week turnaround cycle on these. We fund 1 month in arrears, so applications that come in May are then reviewed and funded in June. A lot of these other criteria are still the same. Those receiving breast cancer treatment, surgery, chemo, radiation. Chemo can include the antibody drug conjugates, the HER2 therapy, immunotherapy, and then as well as MBC patients. And so, as Susan mentioned, we're covering all of Oregon with this program, as well as in Washington, Clark, Cowlitz, Klickitat, Skamania, Pacific, Waukechikum, and then those that express that they're having financial hardship and need some assistance. And so just scroll
And does
down.
the allotment amount, Jenny, depend on?
The
What?
allotment amount is not a set amount. It depends on how much we have in any month. Well, per year broken down to the month, and then we're getting just a huge influx of applications. And so it depends on how many individuals apply every month.
In that month? Okay.
Yeah.
I mean, the good news is the program's more flexible, and the stress
For
point
sure.
for staff is that the application numbers are soaring, as with lots of financial aid right now. So we're doing the best to help more, and try to keep the amounts at a level that's somewhat helpful and not small numbers, because the need is so great. And so we're just trying to kind of calibrate that month over month, Michelle.
Yeah, I'm trying to help more folks. And there is a note here, I just want to point out that a patient cannot apply for both the financial assistance program and the Holiday Glow program in 1 year. As Susan mentioned, we've just been slammed with so many applications, and we're trying to make sure we can help more people.
Okay.
All right, so come down, oops. Okay, so over here we've got the button for you as a provider or whoever the provider will be to fill out this form. And most of it is just, basic data collection. So we're collecting patient name and address. Want to really make sure we get that accurate address. We're asking and tracking where we're serving patients in the counties that they live. So we're asking for the county, not the country. Basic demographic information. Asking how many people in the house are employed, how many are under 18, when the person was diagnosed, their cancer stage, hospital and county where they're receiving treatment, insurance type, whether they've been awarded by us or another organization, provider information, whether the person would like to sign up for a metastatic breast cancer newsletter or a general newsletter, and then hit submit. And I will say that all of our financial assistance applications, once you hit submit, you will get an email confirmation if it went through correctly, which I know can be important to track for you all. And then I did just want to hop over here and cover this release of information. So this, the patient needs to fill out themselves. And I had another person in our training yesterday who mentioned, and I thought it was an interesting idea. She asked her patient to fill out this part first to ensure and then say, let me know when this is filled out and then I'll fill out the application itself. So it's always a struggle. Patients have lots of things going on and it's hard to get them to be able to fill this out. But if we don't have this ROI, we cannot consider the application and we want to help everybody that we can. So we really want to make sure we get this ROI filled out. Basic information, patient information here. This is auto-populated with us, Pink Lemonade Project. And here the patient can just check off this first box. And if a patient has received or is going to potentially receive financial assistance multiple times, we only need this form once. This form is also used for our mentor program because they are sharing some of their diagnosis and their treatment with us and the mentor. So this is that same form that we use for that. And again, if we have it once, then that's fine. We don't need another one. This auto-populates, oops, excuse me, here, this just is our organization. And then here between these two checkboxes, it's basically just if the provider suggested this program to the patient because they thought they may need it, or if the patient requested it, then that's the box that you check. One of those two is fine. If there's any restrictions, there's a date option as well. Basically, it just says that if the patient wants us to discard this after a certain date or after they're done using it, they just put that information there. And then there's a signature box here. And so this can be filled out on any tablet, computer, phone. If you've got them in the office with you, you can have them, pull it up and have them walk them through it right there. So lots of options there. Let me stop sharing this screen. Back to the other. All right, can you all see the support groups page?
Yes.
Great. All right. So on
Yeah, sorry, Jenny, it's got the
in the other
next
view
slide
again. Yes,
version
yes.
too.
Thank you.
So if you do one more click, it'll be even easier to read. Perfect.
There we go. All right. So reviewing some of our support groups here, and we have a new one that we're very excited about. So in our peer support group category, we've got Zest, Lemoncello, and then a new in-person Lincoln City support group. So Zest and Lemoncello are virtual groups. Lemoncello is open to any age, Zest is geared more towards younger folks, just because oftentimes there is a different sort of lifestyle going on. They may have kids, there's other issues. There's no hard edge for this, it's just where the person feels comfortable. Lincoln City is now a new in-person support group. We're partnering with the Lincoln City Community Center out there, as well as a wonderful survivor named Sally, who is also a former licensed clinical social worker, but she's doing this strictly as a peer. So she's very excited to get this going. This meets twice a month on the first and third Mondays of the month. And then we have our clinical-led support group partnerships. We have the Women's Advanced Metastatic Group with Legacy, the All Women's Cancer Support Group with Compass, and then we have a Spanish speaker support group led by native Spanish-speaking licensed clinical social worker, and that's in collaboration with Northwest Family Services and Oregon Child Development Coalition. And then we also have the Cancer Queers support group, which also does art, and I believe they meet in person.
Is the Spanish speaking one also just in person, or do they do any?
That one's virtual.
Oh, good. Okay.
Yeah. And so, which is really great because then anybody can jump in from
Yeah.
all over. Yeah. And we also, well, I'll get to that in just a little bit. And then we have our MBC community. So Living with MBC. We have a newsletter, as I mentioned earlier, that can be signed up through the website. But we have an advisory council made up of MBC individuals, as well as Dr. Allison Conlon. And they help oversee our programs in terms of helping advise us as to what they think the community might be interested in. They also work on what we call our Quarterly Quench. It's an MBC-focused newsletter by and for MBC patients. And then with the MBC Council, we try to come up with events similar to the program events. Some of them are social, but also medical specific ones or medical education ones by experts on topics of MBC or topics that may be helpful to those living with MBC. There we go. And then our retreats, which was our original program here at Pink Lemonade Project. These are led by oncology facilitators. And this year we're doing, and last year as well, we're doing day-long formats for our retreats, and they've been really well received. We've been doing them out in Hillsborough at the River House, which is a really beautiful location. So these are for folks who may have finished, active treatment. The big active treatment things, chemotherapy, radiation, surgeries, we understand people are on medications for multiple years after that. And it's not that, it's just sort of that they're coming up out of the intensity of all the treatments and wondering what's going on in their life now, what their new normal is. And these retreats are designed to sort of address people's concerns at that point in their journey. And then we also have specific retreats for those living with metastatic breast cancer. And then what I was going to say earlier in the Spanish speaking support group is we also have a Spanish speaking retreat. And so that's led by licensed clinical social workers who are native Spanish speakers and culturally sensitive and appropriate to that group. Oh, Susan, you're muted. And do we want to pause here and ask any questions real quick? No? Okay.
So just sort of an overview slide, but again, our partnerships and our impact work really are doing more to try to get ahead of a diagnosis and then really look at some of the bigger systems change work, or really how we as an organization can support really all the cancer centers with things like our community resource guide or some of our program brochures in multiple languages to really help anyone who gets diagnosed with breast cancer. We do work in both states with the breast and cervical screening program. So in Oregon, the Oregon Health Authority and its contractors, and then in Washington with the Carney Breast Center to help refer to the free screening programs for un- and underinsured individuals. I mentioned quickly, but we do work with a network of churches and faith-based organizations to do more Worship in Pink and Breast Cancer Awareness Month activities in October. And then I'll speak to the CHW project in a couple of slides. Is this me or you, Jenny? Whoops. This is
You.
Again, mentioned, but we're tabling at more and more health fairs, and our breast health shower cards have now been translated into 10 different languages. And then we have a shower card with native imagery for our native partners. But we're really trying to get information out about breast health and just breast health changes. And then we're partnering, I mentioned with the breast and cervical screening partners, and also work with the OHSU Tuality mammogram van for screening events at FQHCs and community-based organizations around the, I would say, extended Portland metro area. At this point, there's a shortage of full mobile mammogram units really in all of Oregon and Southwest Washington, and we're trying to support organizations that are trying to expand the fleet, so to speak. And then our community health worker trainings I mentioned, but in partnership with OHSU for the past 2 years, we've been trying to fill that cancer content gap for our very important community-based workforce. Together, OHSU and together, Pink Lemonade Project and OHSU Knight Cancer Institute do a general training or general cancer training with some examples using breast cancer to talk about screening guidelines, risk factors, health promotion factors, et cetera. And then really sort of developing some communication or how to offer peer support to someone who might be afraid to go in and get screened, and or someone who might be newly diagnosed and just sort of overwhelmed by the sort of the shock of a cancer diagnosis. And then Pink Lemonade Project ourselves has a separate curricula, which goes much deeper into the details of breast health and or breast cancer overview, including prognostics or just sort of the examples of different types of treatment. We're not offering medical information, but we're just, it's really building on what our peer mentored training was about, and or, if someone would call me tomorrow with the new diagnosis, sort of what my kind of overview and pep talk is for them, being a survivor, and, how I would explain kind of what's coming next. So that we're doing ourselves, and also, again, for both clinically based CHWs and community-based CHWs. And there's a lot of interest in that project.
All right, and then we've got our community resources. So we have a database as well as a PDF that is downloadable thanks to a grant from the OHSU Knight Cancer Institute. And so this is a resource where folks can search by financial assistance, by appearance, if they need help finding wigs, lymphedema sleeves, if they're looking for any other kind of support, cleaning services, any other kind of emotional support as well. And so, as I mentioned, it's a searchable database from our website, and then you can also download and or share a PDF there. And then we also have awareness materials. We have these in 10 different languages, as well as one native themed breast shower card. And you can see the languages here. These can be ordered on our website, and we can also do co-branding specific things as well. And then we also have just PDFs. So if you want to share these electronically versus having physical ones, we can do that as well. All right, and so here's my email address, and I can drop this in the chat as well. I'm also going to drop a quick survey into the chat, asking you all if you don't mind to share with us. And we really do appreciate your time today and want to take a moment to see if you have any questions.
Yeah, Angela just wrote if we can send the recording and the slides, Jenny, which yes, we can, Angela.
Yes, yeah, definitely.
Any questions?
I
I'm
don't think so.
curious, have you attended this training before?
Me?
Any of you?
I was working for Asante in Grants Pass and used to go through Komen and all that to do this project back before it became Pink Lemonade Project. But so I haven't through you guys since I started here.
Oh, we're doing a lot more than Komen did.
Yes, you are.
and I should put it that way. Komen's amazing, and they first of all, they funded research, which we don't do, and their programming was much narrower. And Pink Lemonade Project is been able to really broaden our scope with the ability to take over the Komen programs that we got. And I think we use it, or we've got a much broader range of things just because we're a different structure than a national federated nonprofit system.
Right.
So anyway.
I think you answered all my questions because I just kind of jumped in and asked.
Yeah. No, that's great. That's great.
No, thank you. Yeah.
Anything else? Thank you for all you do. There's a lot of cancer and breast cancer right now, so you're an important part of the team. And I can just say, as from a patient standpoint, you round out all the medical care. So what you do is needed and important to get someone over sort of through treatment and through their recovery, which is quite the slog. So thank you for all that you do.
Yeah, thank you so much. Thank you for coming. And please, if you have any questions about anything that we covered today, especially I know a lot of you use the financial assistance, feel free to reach out.
Thank you.
All
What
right.
you guys do makes a huge difference. I see it every day. So I appreciate all the efforts, and it's wonderful.
All right.
Awesome.
Thank you.
Thank you so much. We appreciate the feedback. All right. Have a good day, everybody. Thanks.
Have a good day.
Bye.